Hello everybody, this is our finished non-communicable disease clinic. I just want to give you a 360-degree view. We start with our algorithms. Here we have epilepsy, here we have asthma, and here we have diabetes and hypertension. So a clinician can easily come here and follow each of these steps as a guide to how to manage somebody with diabetes and hypertension. We also have some admitting orders here, so they can just go through and tick on what it is that they would like for a patient with diabetes who's going to be admitted. We have our diabetes phone list. We have a photo of myself with Fisgani on the left. He's the nurse in charge of the clinic. And we have Lloyd Kachama on the right. He's our clinical officer in charge. We have some more information here, management and referral pathways. This is for complications like nephropathy, neuropathy, and poorly controlled diabetic patients. Some more information. This is the sliding scale here for patients that are admitted. This is our group photo here. We did a training and now we have 11 people on our diabetes team. These are our biggest resources here. This is the algorithm for diabetes treatment. Ask yourself, do they have diabetes? Is it safe for outpatient management? Do they have type 1 or type 2? If they have type 1, you come over here and this guides you. If they're type 2, then you come here. You decide what is their blood sugar range. Are they a fat or thin person? Which medication you should start, and then how to review them. We have our guidelines for a diabetes clinic. This is the initial visit. This is the nurse's responsibilities, followed by the clinician's responsibilities. This is the 3-month visit, what the nurse does, what the clinician does, and then annually what the nurse is responsible for, and also what the clinician is responsible for. On this we have the algorithm for hypertension. So you ask yourself these questions. And the biggest thing is if they have nephropathy, because the medications will be different on how you manage the hypertension. Then we have our bookshelf here. Here we have our MasterCards. So we have actually registered each patient with their own unique number that we write in their health passport book. Then they can, every time they come in, we just find their individual number, and we have their details here. We have the risk factors, we have family history, patient history, and some complications here. So we can have as many patients as we need to, but for starting we have about 23 patients. So this book is here. We have BP cuff. We have some resources here. We have gloves, some patient handouts. These are some symptoms of diabetes. We have our inventory sheet here, so after each clinic we can make sure that all of our supplies have returned to their rightful place. These are some patient handouts about diabetes. We have one in Chichewa, one in Chitumbuka, and one in English. And then they can read them while they're waiting if they like. This is a handout for some diet information we can also give to patients. So this is our desk. This is just a calendar here so that we can say when our next clinic should be. So for the month of September we've indicated the 27th. For the month of October we've indicated the 25th. This was our initial diabetes register. This is where we were just gathering initial information, such as name, village, phone, address, TA stands for Traditional Authority, and then we have the date here. So as you can see, we have 1, 2, 3, 4, 5, 6, 7 pages. So there's 4 names on a page, so 7 times 4, we have 28 patients registered, which is just the beginning. In these drawers, they're locked, but we have other blood pressure cuffs, and here we actually keep our glucometer with our strips and our lancets for checking the diabetics. We have to keep things locked up because they can grow legs and go walking away. Here's the sink where they can wash their hands, or the clinician or nurse can also wash their hands. This is what we call a height board. So somebody just stands here, and then we're able to get their height. After we get their height, then we calculate with the weight their BMI, body mass index. So these charts guide us whether somebody is obese, within normal, or maybe they're malnourished. Then we have some other aids to help us. This is instructions on diabetic foot care. More information for diabetic foot care. Then we just have a poster describing what diabetes is, some foods that make the blood sugar level rise, why we want to control blood sugar levels, which is our biggest thing here. The reason why we have the clinic is because we want to manage people. We don't want them coming in with complications. We want to prevent complications. So we try to keep their blood sugars in the normal range and also their blood pressures as well. These are some tips on staying healthy. Then we have some other information. This is in Chichewa. These are some signs and symptoms, what to do for low blood sugar. And this is their food guide with Nsima Mgaiwa right in the middle. So that's a traditional food here. It's a lot of carbohydrates, but the less processed one is called Mgaiwa. So that's the recommended one. This is from the Diabetes Association of Malawi. Some foot care tips here, and then some information on injection sites. So here you see the Diabetes Association of Malawi. Over here we have some more information, some sick day rules. What happens if a diabetic isn't feeling well? What should they do? And then here we have some examples of a menu for a diabetic, here and here. You also have information on what foods to avoid, what foods you can have moderation, and what foods you can have all you want, like vegetables. So here we have our examination table, and then we have some curtains here, and then outside you'll just find the rest of the hospital. This is actually maternity ward, people waiting to deliver their babies. And then there is the chapel where we meet for morning report. And then we're back to the front of the desk. So you can see it's very colorful. So I hope you've enjoyed this tour of our diabetes clinic and non-communicable disease clinic. We've come a long way. It's been about 5 months to get to this point. So I'm handing everything over to my Malawian counterparts, the clinician and the nurse in charge. So I just want to show you the front of the door because that was a big thing for us. It says NCD Clinic. It's the first here at Embangweni. So let me just take you there, and then I think we'll conclude our tour. And that's all. Thank you for coming. Have a great day.